Yes. Karibu sana, Daniel. Daniel is doing a fantastic work. And he said there are many ways of giving back to the community. So currently he's sparing his precious holiday and flying home to go and give back to the community. Hongera sana for the wonderful work you're doing. So let us know, who is this Daniel? Tunamwananga tuko Daniel. Who is this? And then we can now jump into the discussion.
Yeah, I hope you can hear me.
Your volume is a bit low, but we can hear you. It's my volume.
Is it better? Okay. Yeah, my name is Daniel. I grew up in Kenya until the age of 21, where I left Kenya to come for studies to Germany. I'm a medical doctor who studied in Germany, and I come from Kisumu Lake region, actually from Uyoma, from Siaya County. But I didn't grow up in Siaya. I grew up in Nairobi, in a place called Isili. I don't know if you guys know the place. So yeah, it's a privilege and a pleasure to be here. I thank Caroline for welcoming me to the AG Career Hub and for all the connections which have arose from henceforth. And yeah, I'm here to answer all of the questions which are open and to share all I can share with you guys. Yeah.
Yeah, thank you. Isili, yes, Sisi was say, lazima tuna, we need that background. Where Isili is, yeah. Thank you, Daniel. So why medicine? Why not something else? Why this particular field?
Yeah, the thing is, the dream of becoming a doctor arose in Isili, actually. For those who know where Isili is, it's not a place where rich people live in, but it was also not a very poor place. But living in Isili taught me to treasure life. And as I saw many young people dying because of robbery or accidents, car accidents, and having no solution for this. But I remember when I was growing up at the age of around 10, 11, that is where I decided to become a doctor when HIV was really a topic in Kenya. I remember many of my aunts and relatives dying because of HIV, and no one knew the cure. So it just started like a joke. We said we'll find a medicine, a cure for HIV, and we'll become a doctor and change the world. So this is like the driving concept which made me actually study medicine. So I've been thriving to study it since I was a small child. Of course, now and then I thought about doing something else, but I knew the only thing I can do to change lives is being a doctor. Yeah, and so that's why I chose it here.
Wonderful. It's a calling, actually. Like I keep saying, personally, I cannot become a doctor, but I say that's a calling, and it's not just doing this for money. Well, for the good doctors, yeah. Let me say, for the ones who are really doing it according to the calling. So pongera sana. So we have people who are like, so what is the structure of studying medicine in Germany? What are the requirements? Can I study medicine in English? That is a very frequent question that I start. And then now we can go relate to the Dokis advice to figure out why you're doing all this and who is behind Dokis advice and where do you need our support?
Yeah, medicine. Well, I studied medicine in Mainz. That's in a province called Rhineland-Pfalz. Yeah, studying medicine in English was my dream, but I got bitterly. I just realized when you come here, only few people beginning from the airport could speak English. And I realized that studying medicine in the English language is a dream, a good dream, but something which will most likely not happen in Germany. In Germany, we study medicine in the German language. The German language is the most important tool for anything whenever you come to Germany. 3 of the countries in Europe speak the German language, but in different forms. but especially in Germany, where 80 million people live in, you can imagine it's a huge number. You have to really know the German language and be able to speak and understand what they're saying. This begins from the writing of letters or introducing yourself to the Germans in the German embassy, and also going to the courses, all of the courses you can imagine, biology, chemistry, and physics, all of this in the German language, so everything is like translated. That was the most important thing I needed. At that time, I remember doing intensive courses for 3 months, day in, day out, studying the German language, just like Max. The thing is, I also didn't know. When I came, my brother invited me. I would also like to thank him. He's in this group today. He invited me at that time to Germany. So me coming here, I didn't know that my KCSE was not recognized. So I had to sit in class for another year and do mathematics, biology, chemistry, physics, maths, or physics, and what am I missing? And the German language. And I had to do all of these scientific subjects in German. So this takes like 1 year. That's called the Studienkolleg, which we practically have to go through. Maybe the new school system will change this. But for us KCSE candidates, we have to go to Studienkolleg. That is 1 year spent practically just learning the language. Mm-hmm. After that, there was a thing called the Feststellungsprüfung. This is where they decide if you are capable or if you can go to university. There is a number of African students or international students who can go to the university directly from the Studienkolleg, but they normally only pick the best. Yeah. So you have to be like, if you are the 5 of you, 3 of you have to be the best in order to be admitted at the university. And if you fail the exam, you have the option to study somewhere else or study something else. Mm-hmm. So this is what happened in Mainz, where we were studying like freaks, a day in, day out. And I got, glory be to God, admitted to the Johannes Gutenberg University in Mainz. So the structure of medicine when you go to university looks like this. You have 2 years where you repeat all the subjects again. You remember I did it for 1 year, and then you repeat everything else. And other subjects like anatomy or other subjects which do not appear in Studienkolleg, you'll also repeat them. And then after 2 years, you have to do the biggest, one of the largest medical exams called Physicum. Physicum is practically a filter. It filters out everyone, everywhere. So those 2 years are the most bitter years in Germany. I can't imagine how we made it, how I made it, but those are the most bitter years of my life. But then after doing the Physicum, you still have 3 to 4 years in the clinical studies. That's what they call it. You go to a hospital and you do more seminars and you have more patient hand-on treatments than when you're doing the Physicum at the campus. After all of these 5 years, what happens is the 6th year is practically a practical year where you work with doctors in the hospital and you like do blood tests and learn how to write letters. But practically, this is a slavery year. All of us have to go through it. You earn like 300 euros a month, which is for the quality life here really less. But we have to go through it. And then after the practical year, you can just, you can try to find a job in one of the hospitals. From that time on, you're a doctor and you're a licensed doctor and you're allowed to work in Germany actually forever, unless you make a big mistake, which shouldn't happen. Yeah.
Wow. Thank you. Thank you for giving us the background. I've interacted also with several medical doctors. We also featured a few on the platform. So if you're really interested, you can reach out to us. We also do coach international students who would like to study here. And we also connect them with mentors. So if you're really interested, we have another mentor today, and that is Daniel. So Daniel, I think the goal of the meeting was to know what are you exactly doing. And I'm very happy to announce that you'll be going in October to Kenya with 3 medical doctors and 3 nurses from Kenya. And one of the goals of the AG Career Hub is to see how can we give back to the community. And sometimes you wait to win lotto or to after we've bought enough plots and we have invested in the real estate, then we're like, now we can go back and give the community. But there are many ways on how we can do this. And when I saw your post, I think I saw them from your cousin. I was like, I have to find out who this person is because that is my nature. I want to expose all those people who are trying to change the narrative of Africans and the narrative of Africa. And I believe we can, if we team up together, we can bring a lot of positive change. So tell us, what is Doki's advice? Why did you come up with the concept? And talk as much as you can. And then we'll have towards the end a section where we'll have the Q&A. People can ask questions. People can say the areas they would like to contribute and hoot up.
Okay. Yeah, Doki's advice. Actually, so where should I start? Doki's advice was initiated by a series of events, of tragic events in life, from relatives in Kenya and even friends, where actually I came to study in Germany and then leave Germany and go back home and work at home. But now that I have a family and my children are big, I had to rethink my concept. And I didn't want to wait for a long time until I started something which will give back to the society where I grew up in. So after experiencing or seeing premature deaths and even disability of patients happening in normal and local hospitals, it was like every time I had these stories, my heart was burning and I was saying, man, we have to do something. We have to change this. We have to really, there has to be something we can do. So I was like forced to kind of just start doing something because of the energy and the impression which I had to change lives and to help people understand their diseases and even to challenge the current medical system. Because I realized that most of the people are living in the system and they think it's normal. Yeah, the treatment is normal. I'll give you an example. The example is antibiotics. We all, when we were children and we had a cough or when we had fever, high temperatures, what did they give us? They gave us syrups which contain antibiotics. For us, it was normal. We just drink that thing and think, okay, yeah, now I'm doing better. It doesn't taste so well, that penicillin or ampicillin, but we took those drugs. So because we took them and the pharmacists, the ones who we relied on, they were the ones who recommended us to take these syrups. We believed in it and we took them for decades. And no one asked the question, what is in this bottle and why should I give it to my child? Different to the people living here in Europe, to the Europeans who definitely ask a lot of questions. They think about what they take. They look at the contents of the medicine they get. It was like there was a kind of comfortability which was built in Kenya, where you are a patient, you go to the doctor, you believe everything, and whatever happens, happens, and if it doesn't happen, it's okay. So after watching, I can give so many examples, but today I just restrict myself. So these are one of the things which shocked me, but the thing which shook me the most and really brought me to thinking was when my father got a heart attack. We knew it was a heart attack. We sent him to hospital. And I remember at that time, fortunately, I had my cousin on the ground who happens to be a doctor. So she kind of drove with him to the next hospital, like 1 hour away from the village. And when they arrived, it was like, we know that something is wrong with him. We know he has a heart attack, and we were saying, people, we need an ECG and we need troponin levels. Those are exams which you normally do in the first 10 minutes. They're the most logical exams. But when we were talking on phone, it was like nothing was happening in this direction. Yeah. So even when the ECG was taken and the blood tests were done, after the morning after, when they sent us the ECG, which was obtained to be normal, I saw this ECG is not normal. Yeah, and he has to leave the hospital actually immediately. Now, this was like in Kisumu, and I had to move into Nairobi because the necessary treatment could not be done in Kisumu. So it was like either he drives by ambulance for 8 hours, or we fly him to Nairobi, which he is too unstable to. So when he reached Nairobi, I just skipped that step. When he reached Nairobi, they told us, you guys, 4,000 euros for admission and everything, otherwise we won't do anything. And I was standing there here, 8,000 kilometers away, and my brother stood, and we were like, okay, so this is a system, yeah? That means if I don't get the 4,000 euros, which equivalently in Kenyan shillings are like 400,000 Kenyan shillings, if I don't get them today, he will die, because I knew the outcome of the disease. So at that time, when I was speaking to my brother on phone, we realized that what if it could have been just a simple neighbor in Isili where we grew up, or maybe someone in Madare, or maybe someone in Kibera, and you tell them we need 400,000 in order to treat you adequately, or you die. We realized we have a big problem, and we have a system which is not working for everyone, but for those who have money. I understand that the instruments are expensive. I understand that the work and the work of the doctors has to be paid, but I also did not understand what the poor person will do. Must he die because he doesn't have money to pay the necessary treatment? Is that the only way? So that is where Doki's advice was born from. And I said, well, maybe I cannot give them the money they need to go to hospital, but I can give them the knowledge to understand how to avoid some diseases, some particular diseases which could be expensive afterwards. Like, for example, the controlling of blood pressure will be good and will even prevent someone from getting a stroke or a heart attack. So I was aiming at doing prevention care and helping people to understand what kind of diseases they have and what they need to take care of and to see and to do. Like many of the diabetic patients, they eat a lot of chapati, ugali, yeah, potatoes. All those are starch, yeah. And I understand that most of the people don't have enough money to feed themselves or have the right nutrition which they need in order to stay healthy. But then I knew that if they get sick, they have a big problem, and their families have a big problem. Some of them have to sell their land, some of them have to sell everything which they have, and I didn't see this as necessary. But all in all, I also realized that even after giving them the knowledge they need, which is not accepted in every place or from every person, because people have their own head, which is also okay. And like, if I tell some of the parents, don't give your child antibiotics today, they still do it because they're used to doing it. They receive it from their parents receive them from their other parents. So it is like a series of a failing system, which is ongoing. So I realized it is not enough just to give knowledge, but it is also important for me to go to the ground and to help them where they are. So the first camp was like just being there to diagnose or to help people understand which diseases they're suffering from. Like I had people who were suffering since a year from particular diseases, and they were never rightly diagnosed. And that was the first step, like saying, okay, I am here. Yeah, I know we don't have doctors around us. Like in the first camp where I was the only doctor around the region. So I started giving the help which the people need at the village. But I am also aiming to do more. And actually, I realized the most important thing for me is to also train the medical students and the clinicians, because the clinicians play a major role in our society in Kenya, other than here in Germany, where you have only maybe a few percentage of clinicians and only doctors. In Kenya, it's the other way around. So you have like, you may have one doctor in a hospital, but 20 clinicians. So the lives of the patients are dependent on how fit the clinician is. But we're giving the clinicians the least medical knowledge they could get in order to treat those patients. So we can see that there's a lot to do, and I know I have a big dream, but with the help of everyone, with the help and the support of everyone, I think we can reach a place where knowledge is easily accessible, and where good health is normal, yeah, and not the other way around. And so that is what I'm aiming for at Dokis Advice. Now, the body, Dokis Advice, has grown throughout the last 6 months. Actually, Dokis Advice is something relative new. We have doctors around us. I have a neurologist who happens to be my cousin, Harun Jago. I have a neurosurgeon who happens to be also in this meeting. He will share about his project in short. And I also have an ophthalmologist. I have and 2 other internal medical doctors, and all of us are Kenyans. So we are all Kenyans who once came to Germany to study, and we want to give back to the society. I also have 2 doctors in Kenya who are also helping me help the patients on the ground. One is a gynecologist, and the other one is a physician and a general physician. So the thing is growing. The more doctors we have, the better. But we are planning, like, for next year to arrange more camps where I don't have to be present, but at least we have doctors who will be on the ground and take care of the patients and doing the necessary tests. So you've opened the website, as I can see.
Yes.
How do we finance all of this? That's a question.
Mm-hmm.
Yeah, most of the people think we have a big organization behind us who are supporting us. That's not the case. We finance our flights, our accommodation, wherever we eat, wherever we stay, we pay it from our own pockets. If I will wait until I have an organization which supports me, I would wait forever. Yeah. So the thing was like, I know I want to go to Kenya to visit my parents. So what I do is I take, for example, 2 weeks holidays. 1 week I give it back to the society, and the other week I go and spend time with my parents, who happen to still live in Kenya, in the village. Mm-hmm. So I created some programs which will help me help others. People look at the prize donations and think, oh, it's all about making money. It's not that. But everything, every single cent which comes to the account of Dokis Advice goes back to the patient. Mm-hmm. So that means, for example, the diaspora program, you happen to have a sick relative at home. The person lands into the nearest hospital, and you don't know what is happening, and everything is going here. You call me and say, hey, Daniel, we need your help. Can you look at this lab results? Can you look at this ECG? Can you look at these exams? Can you tell us what is missing? What is necessary? And at the moment you call me, I say, okay, yeah, give me the number of the doctor. I want to speak to him. And then I contact the doctors on the ground, and I talk with them about the patient. And I start talking with them about the patient's diseases. So at this point, I don't know how long the consultation will take, but I created a diaspora program with 3 levels. Level 1 is up to 3 days of consultation. Level 2 is 7 weeks. Level 3 is like more than 7 weeks. Like if you have a patient in the intensive care unit and you would like me to support you in this, in the treatment, and because you are here, because I know the feeling being here as and you know that your relative, your father or your mother is lying on the hospital in a Kenyan hospital, and you don't know what to do. I know that pain, I know that anxiety, and I will be there just to look at everything and review all of it. Wow. So at this point, I will say, okay, if it took me 3 days, if it took me 1 week, and you don't need me anymore, you have the chance to donate a particular amount to Dokis Advice. And whatever money you donate to Dokis Advice will be used to pay another patient's bills in another hospital. Like now I have 3 patients pending. They're not yet on the homepage, but I know that they will need that money because they really have diseases which have to be treated soon. And they will need that money in order to get their exams and surgeries done. And then I have the other €5 patients. €5 patients is a project which was initiated in Luak Hospital. When they told me that they have like hundreds of patients who are diabetics and hypertensive, but they don't have the necessary drugs, or they can't pay for the drugs because they have to pay 500 bob per month. And so some of them can't pay because they're not working, they're widows or widowers. Some of them are orphans and they don't have the money. I said, hey, 500 bob. So if I come back to Germany, I think for most of the Germans, €5 is one dish called döner. That's how we call it here. There's a Turkish dish which only costs around €3 to €5. So I said, so if everyone in Germany just donates a piece of doner, then we will have all of the patients put in. So that's when I began making adverts about the €5 patients and telling people, hey, you can change someone's lives and help them to prevent a disease throughout the year by donating €5 every month for 12 months. I am happy to have more than 5 donators who did this, and I can tell you that now for the last 3 months, 5 patients have been profiting from this project, €5 patients. And the Pamoja program is actually my initial program. It was all about Dokis Advice and what it is for. It was like giving the money, like for example, I will do consultation or whatsoever, and the money the people donate from outside, from Europe, from Kenya, will be used to also help some patients, particular patients which we choose. We will also update their details on the website. If you go to learn more, for example, at the Pamoja program, if you go at learn more, you will see, yeah, that's a red button. When you go back up, just below the right, Dokis Pamoja program on the right, and that one, yeah. So when you go to learn more about the project, you'll see what Pamoja project is all about. And when you scroll down, you'll just see that it's all about giving back to the site. You can read this one at home. And then we have the vacation program, which actually was initiated by doctors in Germany who asked me, hey, maybe I don't want to donate, but I want to come and for holidays to Kenya, and I would like to spend 1 week working in a hospital. So I said, yeah, cool, we can do this. So I created this vacation program where you can go and work, and afterwards go for vacation in Mombasa or in Tanzania, in Mount Kilimanjaro or Masai Mara, wherever they want. So the vacation program is only for medical workers like nurses and doctors or radiologists who just want to give back to the African people, and also have vacation on the ground. So this is all what Dokis Advice is about. I don't know if I've forgotten anything, but as you can see, there's a lot of work to do. We need all of the donors we can get, and we need all of the help we can get from the nurses and doctors who are maybe watching this video. It isn't about only bringing doctors to Germany, but we also want to give back to the doctors in Kenya. And one day we will have an institute which will give them the same level of knowledge of the European medical knowledge, and also and pay them accordingly. That's the aim we are aiming for. And I know that there are many Kenyan doctors who want to go back to Kenya, but the lifestyle they live today wouldn't be imaginable back there in Kenya.
Mm.
So if you allow me, I will go, I'd like to talk about the next camp. I would like to give it back to my brother.
Mm-hmm.
Or is there anything I have forgotten?
Wow, I'm just touched to see what you guys are doing. And I lost my brother 2 years ago, so I know the pain of not having that medical support on the ground. And I think what you guys are doing is really fantastic. And if we all did this, I think we would save at least 50% of mothers and fathers and children who would not have died just because they did not have access to the facility. So let's do it. Let's support where we can. That's why we are doing this. It's not about money. It's about the impact. And something else, we are raising children. Let's raise the children also, showing them that we can do such things to bring the difference in the society. So from my side, hongera sana for the wonderful work you're doing. Yes, Daktari team, karibu sana.
Let me switch on.
Yes, now we can hear you. Now
thank you so much. Yeah, thank you, Caroline. Thank you for inviting me. Thank you, Dan. Yeah, thank you also for the work you're doing. I mean, I've been following your channel. I see what you're doing for many years. Really grateful for that. Yeah, so Dan is my younger brother, although I look younger, but he's a few years younger than me. Yeah. So I'm a neurosurgeon by profession. I work and live in Düsseldorf with my family, and we also have another organization which has been on for, I think we kicked off in 2017, and the idea was we all know, I mean, neurosurgery. There's a shortage of neurosurgeons in Kenya, and especially in the western regions, like a city like Kisumu didn't have a neurosurgeon before we came in. Yeah, so anybody who had any neurosurgical issues had to be referred to Eldoret or to Nairobi for treatment.
Mm-hmm.
So we came together. We are 3 neurosurgeons. My colleagues and actually also good friends are in the US, and there's also a neurologist. So what we do is we got some, let's say we entered into some formal relationship with the county government in Kisumu, and the hospital there, the Jaramogi Oginga Odinga Referral Teaching Hospital, they invited us and gives us the theater capacity. So we go at least once every 4 months. One of us goes, and we hold these camps where the patients can get free surgical treatment. They have to be enrolled into the NHIF. We have the support of the county government, which has been helping out, and it's also just with the organization, which has been very welcoming to us. So that way we are able to bring neurosurgical services to this place where it has a catchment area of 5 million people, and that service for free, a service which was not there before. So I remember in the first camps which were there, most people didn't even know what we were doing. I mean, even the colleagues who were there, I mean, the nurses, they didn't understand, you know, it was just a strange a strange area, medical area, which was not represented in Kisumu. So that's what we've been doing. I mean, then there was the Corona time, which we had to roll back our program. And it's also, at the moment, it's self-financed. The main organization is in the US. It's called Giving Back to Kenya. The initiative is called Kisumu Neuroscience Initiative. And we are open to anybody, any nurse, anybody who's in the medical field. There's always, you see, the thing is, you go with neurosurgery, but there's always, it's like there's a long tail of other problems which also need specialists, whether you're a nurse, whether you're a pharmacist, so there's always something to do. So yeah, and the next camp is in next month, in about a month, from the 17th to the 22nd of October. There's a Facebook page where you can follow up the cases. There's some material online about the program. And yeah, this time we're excited to have Doki's advice, which is also making a difference in that region. And as I said, we're open. We welcome anybody who's interested, joining in, anybody who would like to make a difference in the region. Yeah, that's it basically. Yeah. And of course, if you have any patients as well, I mean, patients with neurosurgical issues, this is also a good time to look towards the lake. Yeah, when we're there. Yeah.
Thank you so much. I just shared the flyer so that people can also see the flyer of the neurosurgical camp in Kisumu. Thank you so much, Dr. Ogutu, for what you're doing. And I think it's an eye-opener to all of us. It's a wake-up call to see, hey, I may not be in the medical field, but there are many ways on how I can support. I've seen hospitals here throwing away equipment, which we might use back home. Yeah? So if you're out there and you're watching, reach out and see how we can support this noble initiative. And let's also come up with concepts that can be beneficial to our families and friends. So karibuni sana, and wishing you the very best. And anyone with a comment, maybe you can comment something. And I think before now we go to the Q&A session. So anyone with a comment before we go to the Q&A or something to applaud the good work that is being done, or before now we move on? I think we've managed to kick off some of them. I just had one last question before maybe we open the Q&A. Is like, throw the challenge to all of us. Like, you know, so there are people who feel that they don't have the money, they're not ready to start. I think maybe you can throw the challenge to the Kenyan community, especially in Germany, and say, hey, we started, so just start. You don't have to wait for 10 years until you've bought enough plots back home, but you can you can start right away. You can share that slide, that flyer. You can tell them, hey, I'm going to give you some goodies for those patients. There's so many ways on how you can give back to the community, but throw the challenge to us and say, let's start, let's do it.
Is that for me or for the other doctor?
both the doctors.
Well, yeah, I can only share an experience from the last camp. In the last camp, being the only doctor, I had 3 helpers, 3 young men who just, they are not in the medical field, but they were there to help me. I was really grateful even for that kind of help, that they were there. They were like helping me out with the camera, doing the videos. But the most important thing, what I realized was that in most of the facilities, you don't have a lift, yeah, or you have very far distances from the X-ray to the laboratorium and to the exam room. So I was really grateful that I had young men who would just help the grandma or or the old lady or the old man to go from point A to point B, just supporting them and standing on their side because they were sick and they couldn't really walk a lot. That was a kind of help which I was really glad for. Now, this money thing, money will never be enough. Yeah, I don't think we'll ever have enough money to say today we're going to start. I think it's just if you're watching this video and you say I'm touched and I feel like I want to do something, then just do it. Just begin. You can come to any of the camps. You can help us. There's a lot to do. Yeah, there's a lot of translation to do for some of the languages. In Kisumu, there are people who only understand the Luo language. So there is a lot to do, but mostly also we may need you also in the social area just to advert, to share that flyer, to follow our page, to comment on those pages, because one of these days those pages will be paying someone's bills in a hospital. And that is what I'm looking at, and that is what actually we are aiming for in Doki's advice, that we will also become independent in some cases where we have resources which can help others. So every time you like, you comment, or you share, you're doing good to some other patient. And of course, if you have land, if you have a tent, or you say, hey, I only have stools, or I only have a piece of land somewhere and I don't know what to do with it. These are also things we could do. We can use to create more camps, like to call people to come there and to get treated and to get checked up and so on and so forth. What we're also glad for are connections, of course, to the government people, and also to different pharmaceutical companies, just to connect and see what can we do for Kenya as a whole, especially for the villages where only few hospitals are represented. So don't just give up, and don't just let your dream evaporate because you don't know when to start or what to do. There is always something to do. You will always find something to do. And of course, if you want to help us, we will be ready to hear you and maybe to tell you, okay, this is what we need, this is where we need you. Some of the people are good in finances. Yeah, some of them are good in law or in any other area. So Doki's advice is aiming for a bigger thing, which is more than only me. I'm only the picture to it, but it is all of us. It is upon all of us to do this thing and to make it happen. That's my thoughts for today. Yeah.
Wow. Thank you so much. Thank you. Oh, you wanted something, Tim? Big brother.
Yeah, I just wanted to add one more point. Yeah, exactly. The thing is, okay, I don't know how many of us have ever been in a situation where somebody is sick at home. I think Caroline, you mentioned you had a brother, you lost your brother. Someone is sick at home.
We actually needed a neurosurgeon, and we had to wait for so long to get a neurosurgeon. Yeah, but it was a bit too late.
So yeah, it was a bit. So you see that's unfortunately the kind of situation when mostly the Kenyans were in Germany, that you're here, you get the information, they do the tests, they do everything, but you just cannot interpret what's going on. You just cannot, you just cannot coordinate everything. And because you also don't have the knowledge of what's necessary, what needs to be done. And I think with Doki's advice and also with the Kisumu Neuroscience Initiative, yes, we are charity organizations operating in Kenya, but the charity is also here in Germany. So if let's say you have situations where you have questions, you have maybe there's somebody, a relative who needs help, or you just need some advice. Yeah, I mean we are there. The organizations are there. We are there. I just hope and I pray that we can form, because I know many doctors in Germany. There are many. I mean, where people are busy, yes, but we could have a network where people get information, people get consultation, they get the advice they need when somebody's sick at home. They just that information, it's so valuable to be told what you need now is to get an ECG, or what you need now is to do this or don't do that because it doesn't make any sense at this point. So I think that's very valuable information, which sometimes is lacking. We've been lucky because, as Daniel said, when we had such a situation, we knew what we had to do. Yeah, there's still the problem of the deposit you have to pay and all that, but we knew exactly this is the step we need to take. If we don't do this, this is going to happen. So I think just for the list, the people who are watching this to know that the advice is also for you in Germany. It's not only for the Kenyans, even for the Kenyans who live in Germany, who have people who are sick at home, and they need to know which are the steps we need to take. What do we need to do? Yeah. So yeah.
Wow. Fantastic approach. I totally agree, because sometimes you spend so much money and we panic not really knowing what is wrong. So thank you so much for raising the bar and saying that you're ready to help us. We're ready to solve these problems, because of course it's a challenge. And I keep asking myself, there's nothing that we can do on the healthcare sector in Kenya, for example. I'm sure there's a budget for that. I'm sure there's something that we can do, but if we start the discussion, then we might finish tomorrow. But at least you've started working on the pie. So, and we're hoping that once we team up, then we can at least maybe add it to 50% or 50%. And then the policymakers can also see that there are such initiatives that are willing to bring change, because health is wealth. And when you're not fit, then everything else is not important. Yeah, so it's quite very, very important aspect. So hongera sana from our team. And I think now we can close the discussion, and anyone with a question or a comment can just unmute themselves and say something. I just read 2 very nice comments in the chat. Hongera, Doctor and Dr. Gutu, and your dedicated teams for the good work that you're doing. And then we have also another good work, guys. Keep doing good. I think you can see we have the support, and we'll distribute all the information. I personally believe information is power. And so my work is just to spread and to expose all these people out there, and let's bring the change that we need to see, because some of these things, it's only us whom we can solve this problem. So yeah, wishing you the very best within the camp in Kisumu in October. We'll definitely be in touch and support where we can. So let me stop the live transmission, unless you have a closing remark, and then we'll stop the live transmission. Nokia, want to say something? You're on mute. We can't hear you.
Yeah, can you hear me now?
I just say thank you. Thank you for it.
Yes, we can hear you. Thank you so much, Dr. Ogutu.
Okay, can I go ahead?
Yes, please do, yeah.
Yes, thank you so much. My name is Festus Adipo. I'm joining from Kenya, Asembo. I'm in the village.
Oh, wow.
Yes, I would like to, first of all, thank Dr. Dan Ogutu for the wonderful initiative that he has taken. I work for Gralins Hotel. This is a local hotel. We are based in Asembo Bay. We supported Dokis advice by giving them affordable accommodation during the time that they were offering free medical camp at Loak Mission Hospital.
Mm-hmm.
And I would say that actually what they are doing is very wonderful, because here we really lack a lot of we really lack so many in the field of medication. We don't have doctors, We don't have specialist doctors like Dr. Danogutu, like Dr. Tim. Actually, there is none. You can only get them in maybe Eldoret, like a neurosurgeon. I'm sure Dr. Tim is a neurosurgeon, a neurologist. You can't get it here. Even in Kisumu, they are very expensive and they are few. Yes. And for them to offer their services for free to us, actually we say a big thank you. And we encourage them to keep on doing the same job. We encourage them to actually bring in more doctors to help us. And me as an individual, I will offer them very cheap accommodation at my local hotel, Gralins Hotel. We are not a top-end hotel, but we can offer basic accommodation. Like, yes, like if you come to, when Dr. Daniel Ogutu came to Loak, he knows the place. We don't have facilities. And if you come to Gralins, we will give you basic accommodation. I would like to say thank you very much, guys. Thank you so much. Thank you so much. And keep on doing the good job. We support it. Thank you for the time.
Wow.
Okay, I'm done.
Thank you so much. Thank you. Thank you, Barikiwa sana, for even supporting the team that way. See, we can give, by all means. Wow.